Okay, so for hips in lying, the real benefit of the loop here is to provide this closed chain compression, so that the tension coming up through the band, it activates joint proprioceptors in the ankle and the knee, and particularly in the hip, which you need for your glutes. So there's obviously, you know, the side leg raise components that you can do, lifting the leg up and down with a good bit of tension. So the patient is cued to push into the band as they also raise the leg up and back down, and then starting with the leg in front, working that on the diagonal, coming forwards and down, and then pulling up and back. Hip circles are an obvious one there as well. And then keeping the band parallel to the floor, and the person brings their knee in just below the level of the band, maybe still in contact with it, and then lift it up and back down. So in, out, up and down, like those sort of movements. Any combination of those would be helpful. And then their clams, their hand will be down in front and they're opening against the resistance of the band. A lip band probably still for this one would be the same, if not more effective, a little bit easier on the hand, but the first few movements for the band is around the foot when it's in an open chain position. That sort of movement would be helpful. And around under, so we bands out to the side with the knee bent, and then trying to do little pumps, pulling up and back down. So pushing, again, this is turning this into a closed chain exercise where it otherwise would be open chain. So the patient is getting downward sensory input, really, axial loading up from the heel, up through the knee as they go do their pumps. So that would be great for glutes. They could also, from an ACL perspective, do proprioceptive work, where on a knee replacement work, and knee surgery in general, where they have to move their leg against the perturbance of the band there. So up and down, lots of multi-directional small little movements like that. And then we also do this as proprioceptive work after knee surgery, where the person would be trying to control their leg. We're looking for high degrees of reproducibility and repeatability with this, so that they move their leg as fast as they can using their hamstrings and quad control, and then they move down into a lower range and they do the same exercise, and then down all the way into an outer range, up and down like that, trying to be really repeatable and consistent about how their knee is bending when they come back up. Okay.